When we usually think about childhood, um, our minds really tend to gravitate toward these very universally understood, I guess, highly fixable problems.
Right, the typical bumps and bruises.
Exactly. Like we picture scraped knees from a fall on the playground, or maybe, I don't know, a broken arm from a momentary lapse of judgment on a bicycle.
Yeah, the classic childhood rites of passage, really.
Right. And in those moments, the expectation of a remedy is incredibly comforting for you as a parent or just as an observer. You put an adhesive bandage on the scrape, you put a brightly colored fiberglass cast on the arm, and the healing process is, well, it's practically guaranteed.
It's very predictable.
It is. It's this linear, predictable equation of childhood: action, injury, intervention, cure. But then you step into the world of pediatric oncology, and suddenly that entire framework of, fixable childhood bumps, it completely shatters.
Oh, it entirely dismantles that logic. I mean, it takes the fundamental unspoken assumption that we all hold, that youth inherently equals invincibility, and it completely turns it on its head.
Yeah, it really does.
It forces anyone who encounters it into this completely new reality where the rules of cause and effect just don't apply anymore.
And that is exactly what we are getting into today. Welcome to the Funeral Channel Network podcast, where today on our deep dive, we're looking at a reality that is incredibly powerful, deeply complex, and honestly, often entirely misunderstood by the general public.
It's heavily misunderstood, yeah.
I'm your host, and joined by our resident expert, we are pulling from a singular, really moving source document today. It's excerpts from a text titled The Gold Ribbon: A Legacy of Hope and Resilience.
It's a fantastic text. Very heavy, but very necessary.
Very necessary. And our mission for this deep dive is to look far beyond just, a simple piece of colored fabric pinned to a lapel. For you listening right now, whether you are a medical professional or maybe a supportive friend who has watched a family navigate this impossible maze, or just someone looking to be fundamentally better informed, we are going to unpack the unseen realities of childhood cancer.
Right, getting past the surface level awareness.
Exactly. We are going to look at the massive structural gaps in global medical research, and we're going to examine the profound, earth-shaking ripple effects that a single diagnosis has on an entire community.
Because it's never just the child who is diagnosed.
No. So, okay, let's unpack this. Because there is such a sharp, almost jarring contrast here between the absolute innocence we associate with early childhood and the harsh, unforgiving biology of a pediatric disease.
That contrast is exactly the anchor point of our source material.
Well,
And I think it is vital to ground our conversation right there. Because while the subject matter is undeniably heavy, I mean, we are talking about a leading cause of death by disease among children, the core of the text we are examining today is not fundamentally a story of despair.
right. It's not just tragedy for the sake of tragedy.
Not at all. It is an exploration of human resilience. It is about the unbreakable nature of human connection, and ultimately, it's about the mobilization of hope.
Wow. The mobilization of hope. I like that phrasing.
It's what the source really leans into. It looks at how people survive an unimaginable psychological and physical ordeal, and how they weaponize that survival into tangible action.
Which means that to truly understand this global movement, you really first have to understand the specific, deliberate meaning behind its chosen symbol.
Emerald ribbon.
Right. I mean, we see awareness ribbons all the time. The visual language of philanthropy is something we are all pretty fluent in. Pink for breast cancer, red for heart disease. But for childhood cancer, the ribbon is gold.
And that's not a random aesthetic choice.
No, the source goes out of its way to emphasize that the gold ribbon symbolizes how precious children are. It reflects their value, their innocence, and the immeasurable impact they have.
Absolutely.
But it also points out a very stark medical reality. Unlike many adult cancers that can be linked to lifestyle or environmental factors over decades, childhood cancers, things like leukemia, brain tumors, lymphoma, solid tumors, they are not preventable.
That's the terrifying part for a lot of people.
It is. Their causes are not well understood. It is this incredibly rare anomaly, yet, like you said, it remains a leading cause of disease-related death. So why gold specifically?
Well, the choice of gold is deeply intentional, and it operates on a few different levels in the text. From a purely metaphorical standpoint, gold is universally recognized as rare, highly valued, and crucially untarnishable.
Untarnishable. It doesn't rust.
Exactly. It endures extreme conditions. So the authors of the source use the word precious very deliberately because gold perfectly encapsulates the irreplaceable, enduring nature of a child's life.
That makes a lot of sense.
But, if we move beyond the symbolism, what's fascinating here is the biological difference outlined in the text. It's what truly dictates the grim reality of this disease. The absolute inability to prevent childhood cancer fundamentally shifts the entire medical and societal approach.
I'm going to pause on that biological difference, actually, because I think it's something the general public completely glosses over. I know I did. We hear cancer and we just lump it all into one terrible bucket.
Oh, it's a very common misconception, but scientifically, medically speaking, they are almost entirely different categories of disease.
Oh, so?
Well, with adult cancers, public health focuses heavily on prevention, right? We understand the mechanisms. A lung cell is exposed to carcinogens from smoke over 30 years. The DNA sustains repeated damage. The repair mechanisms eventually fail, and a tumor grows.
Right, or like skin cancer.
Exactly. Skin cells bombarded by UV radiation over decades. It is a process of accumulation. And because of that, we have empowering public health campaigns. Diet, smoking cessation, limiting sun exposure.
Well, use sunscreen.
Exactly. But those preventative measures do not exist for pediatric cancer.
Right, because, a 3-year-old with leukemia didn't smoke a pack a day for 30 years.
Exactly. Pediatric cancers are often the result of DNA changes that happen very early in life, sometimes even before birth. They are essentially errors in the fundamental developmental pathways.
Wait, before birth?
Yes, sometimes. An embryonic cell that is supposed to turn into a specific type of tissue it forgets its instructions, basically, and begins to multiply uncontrollably. Because there is no environmental trigger to remove, the entire burden of the medical system has to violently shift away from prevention and entirely toward urgent, rapid, early diagnosis and incredibly aggressive advanced treatment.
Man, that biological difference is staggering when you really visualize it. I was thinking about this, and to put it in a way that helps me conceptualize this, and maybe for you listening as well, if adult cancer is sometimes like a complex piece of machinery breaking down over decades of wear and tear, or being left out in a harsh environment that slowly degrades its parts.
Right, the accumulation of damage.
Yeah, the childhood cancer is entirely different. Childhood cancer is like a brand new, top-of-the-line computer experiencing a catastrophic, completely unexplained system failure right out of the box.
That's a really stark analogy, but it's accurate.
There was no user error. You didn't leave it out in the rain. You didn't download a malicious virus. You just turned it on. And the motherboard short-circuited.
Yeah.
It completely removes the concept of fault or cause and effect that we, as humans, naturally crave to make sense of a tragedy.
That is an excellent way to frame it. The human brain desperately wants a reason. We want to be able to look at a tragedy and say, well, if they had only done X, they could have avoided Y.
Because it makes us feel safe.
Exactly. It gives us a false sense of security about our own lives. We think we can control it. Pediatric cancer strips that psychological safety net away entirely.
But that brings up a massive logistical hurdle that the source touches on. If we can't tell people how to prevent it, doesn't that make public awareness campaigns significantly harder?
Oh, immensely harder.
Right. Because you can't just run a billboard saying, stop smoking or wear sunscreen to empower the public. What is the actual call to action if you can't offer the public a way to protect themselves?
That is the exact friction point the movement faces. Because the empowering illusion of prevention is completely removed from the equation, the call to action has to change its entire frequency.
It has to be totally different.
Yeah, you aren't asking the public to change their personal habits to save themselves. You are asking them to look at a terrifying reality and willingly offer their resources to fund research and to support the families who have literally been struck by lightning.
Wow.
And because the burden of prevention is gone, the entirety of the burden falls instantly and overwhelmingly on the family to navigate an unexpected, devastating crisis.
Which means the system itself isn't absorbing the shock. The family is.
If family takes the full hit.
And that leads directly into the next major concept the text explores.
Yeah.
The ripple effect. The source makes it crystal clear that a diagnosis of childhood cancer does not just happen to the child.
No, it happens to the entire family ecosystem.
Right. The parents are instantly thrown into this labyrinth of complex medical decisions, extreme emotional stress, and frankly, crippling financial challenges.
Mm.
Meanwhile, the siblings are watching their entire world upended.
It's total chaos for them.
The text introduces this concept of family-centered care to address this. But before we get to the solution, let's look at the impact. What happens on day one of a diagnosis?
Well, on day one, the psychological toll on the family unit begins a compounding process that simply cannot be overstated. The text specifically points out that parents are forced to instantly become advocates, caregivers, and emotional anchors.
Instantaneous.
Yes, think about the cognitive load of that. Within 24 hours of hearing the word oncology, a parent is expected to absorb incredibly dense medical jargon.
Stuff doctors go to school for years to learn.
Exactly. They're suddenly learning how to flush a central line, how to monitor absolute neutrophil counts, and how to administer a pharmacy's worth of highly toxic medications at home.
They're essentially forced into an unpaid, highly stressful nursing residency overnight.
Precisely. And they have to do this while making life or death decisions and advocating for their child within a complex, often heavily bureaucratic hospital system.
Which is hard enough to navigate when you're healthy and thinking clearly.
Oh, absolutely. And all of this is happening while they are desperately trying to maintain their jobs, keep their health insurance,
Which is huge.
which is suddenly the only thing standing between them and total financial ruin. And they still have to care for their other children. It is an impossible, unsustainable balancing act.
I mean, try to actually imagine that for a second. Really put yourself in those shoes. Imagine getting the absolute worst news of your entire life, the kind of news that fundamentally alters the rotation of the earth beneath your feet.
Yeah.
And in that exact same breath, you immediately have to become a part-time medical expert, a full-time emotional rock, so your sick child doesn't see you panic.
You can't let them see you fall apart.
Right. And somehow, amidst all of that sheer, unadulterated terror, you still have to remember to pay the electric bill, buy groceries, and make sure the dog is fed. It is a level of pressure that breaks people.
It does break people, which is exactly why the concept of family-centered care from pediatric oncology is so revolutionary and, frankly, so necessary.
So what exactly is family-centered care, according to the source?
Historically, medicine treated the patient in a vacuum. You have a broken leg, we fix the leg.
Right, very mechanical.
But the medical field realized that treating a child with cancer in a vacuum simply doesn't work. The healthcare team has to treat the family as an interconnected ecosystem.
I want to push back on that a bit, or at least play devil's advocate for a second.
Sure.
I struggle with how much a hospital can actually do in that regard. We know the medical system is already stretched incredibly thin. Is family-centered care actually a clinical priority? Or is it just like a nice buzzword for having a social worker hand you a pamphlet about grief counseling in the hallway?
It's a very fair skepticism, especially given how bureaucratic hospitals can be. But in modern pediatric oncology, it is a strict clinical necessity, not just a bonus.
Really? A clinical necessity?
Think about it logistically. If a hospital only focuses on the tumor, but the parents completely collapse under the financial and emotional strain, the child's care inherently suffers.
Because the parents are the ones administering the care at home.
Exactly. Who is going to administer the oral chemotherapy correctly at 2 in the morning? Who is going to notice the subtle signs of a life-threatening fever? If the parents' marriage dissolves, or they lose their home because of medical bankruptcy, the child's physiological outcomes decline.
Wow, I never thought of it that way.
Yeah, the hospital isn't just treating a tumor, they are managing a family in crisis, because the family is the primary life support system for the patient.
That makes a lot of sense. The parents are the delivery mechanism for the outpatient care, so if the delivery mechanism breaks, the treatment fails.
Spot on.
But I want to zero in on the siblings for a moment, because the source uses some very heavy words regarding them. Fear, confusion, or neglect.
Yeah, those are heavy terms.
Is that an exaggeration? Like, are the healthy siblings really neglected, or is it just that they have to take a back seat for a while?
The word neglect sounds harsh, I know, but in the context of the psychological literature, it is highly accurate. Healthy siblings in these situations are often referred to in psychological circles as glass children.
Glass children, meaning people look right through them.
Exactly. They become transparent. The parents' time, emotional bandwidth, and financial resources are completely monopolized by hospital stays and treatments.
Because they have to be.
Right. It's not intentional malice from the parents. But a parent physically cannot be in 2 places at once. They cannot sit by a hospital bed during a chemo infusion and simultaneously attend a healthy sibling's soccer game or help with their math homework.
So what happens to those healthy kids?
The healthy siblings are often left at home, shuffled between relatives or neighbors. They are profoundly confused about why their family is suddenly broken, and they harbor this intense, silent terror that their brother or sister might die.
Oh, man. And I imagine they also feel a tremendous amount of guilt for even needing attention. Like, they know their brother or sister is fighting for their life, so how can they complain that mom forgot to pack their lunch?
That is exactly the dynamic. They suppress their own developmental needs to avoid burdening their parents further.
Which is so unhealthy for a developing kid.
It is. The inclusion of the siblings' psychological well-being in the treatment plan through sibling support groups, play therapy, and dedicated social workers is the only way to ensure the family survives the ordeal intact.
So that's the family-centered care at work.
Right. But, as the source points out, even with robust family-centered care from the hospital, the nuclear family cannot survive this ecosystem alone. They simply do not have the bandwidth.
Which brings us to the external reinforcement. The family is a closed circuit that is rapidly draining its battery, so it has to plug into a larger grid.
I love that analogy.
And the source text spends a lot of time on this exact dynamic, the relationship between the courage of the youth and the assembly of the village. It talks about how these children are facing unbelievably intensive treatments. We are talking about chemotherapy, radiation, major invasive surgeries.
The worst of the worst.
Yet, the text notes, they face this with a remarkable optimism and bravery. And in response to that bravery, the support networks, extended family, friends, local communities, they rally around them.
What's fascinating here is the stark juxtaposition the author highlights. On one hand, you have the intense, undeniable brutality of the medical treatments.
Right.
Chemotherapy and radiation are harsh systemic assaults on the body. We are talking about chemical agents originally derived from mustard gas research, designed to indiscriminately kill rapidly dividing cells.
Wow.
To subject a small developing body to that level of toxicity is horrific.
But on the other hand, you have the patients themselves.
Yes, you have the extraordinary resilience and almost defiant optimism of the young patients. And this isn't just a cliche. It is rooted in developmental psychology.
How so?
Children are incredibly present-focused, while adults project into the future, agonizing over mortality, statistics, and long-term financial ruin. A child's worldview is immediate.
They just deal with what's right in front of them.
Exactly. A child often just wants to feel better right now so they can go back to playing with their toys.
I read a story once, and it perfectly mirrors what the source is talking about here, where a 4-year-old was undergoing a brutal round of cranial radiation.
Oh, that's incredibly intense.
Yeah, they had to bolt a mesh mask to the table to keep his head perfectly still. It's the kind of sterile, terrifying medical environment that would give a grown adult a panic attack.
Absolutely.
But the moment the machine turned off and they unbolted the mask, he just looked at the technician and asked if he could go to the playroom to finish building his Lego spaceship. The sheer compartmentalization of that is mind-blowing.
It is entirely mind-blowing, and the source explicitly links this youthful bravery to the broader community's response. The community's mobilization, the meal trains, the local fundraisers, the benefit concerts. It isn't just a polite social obligation.
It's deeper than that.
Much deeper. When a community witnesses a child enduring that level of suffering with that kind of grace, it triggers an organic, almost evolutionary mechanism of human empathy.
It's a biological imperative to protect the young of the tribe.
Exactly. The community sees that bravery and feels viscerally compelled to act to form a protective, logistical barrier around the vulnerable family unit.
I want the listener to really reflect on the actual mechanics of that community response for a second. We've all seen a sign for a local bake sale, or a link to a GoFundMe for a family, or an organized meal train where neighbors drop off dinners for a month.
Right, it's very common.
From the outside, it is easy to view these as nice, neighborly gestures. But the source frames these actions as vital, load-bearing pillars for a family's literal survival. A casserole isn't just a casserole.
No, it is a highly functional tool of survival.
Right. It is buying a terrified mother 1 hour of time where she doesn't have to plan a meal, go to the grocery store, cook, and wash dishes.
It's buying her time and energy.
It buys her an hour to sit by your child's bed, or an hour to actually sit down and talk to her healthy glass child, or even just an hour to sleep. It is a lifeline that prevents total systemic collapse.
That is a crucial distinction. It is the community absorbing a fraction of the family's logistical and cognitive burden so the family can focus entirely on medical survival.
Which is the only thing they should be focusing on.
Exactly. And the source points out that this ecosystem of support creates a long-term effect. The concept of survivorship in this text isn't framed as just reaching the end of the treatment protocol and going back to normal.
Because there is no going back to normal.
Right? Beating the disease fundamentally alters the trajectory of these lives. Those survivors, having been buoyed by their community, often grow up to become the loudest, most effective advocates for the movement.
But here is where the reality check comes in. Casseroles, emotional support, and community empathy are absolutely what keep the family standing day to day. They prevent the psychological collapse.
Yes.
But empathy doesn't alter the DNA of a cancer cell. A GoFundMe page doesn't shrink a tumor,
Unfortunately, no.
which forces us to look at the one thing that actually does, the science. But when you look at the science as the source text does, you hit a massive, incredibly frustrating wall.
And this is where we transition from the warmth of human connection to the cold, hard, unyielding realities of economics and scientific research.
Numbers part.
Yeah. The text states plainly that pediatric cancer historically receives significantly less funding than adult cancers. And yet, research is the only urgent, viable pathway to finding new therapies, improving existing treatments, and minimizing long-term side effects.
This is the part that genuinely infuriates me. If we connect this to the bigger picture, you have a disease that is a leading cause of death in children in the developed world, yet it is chronically underfunded. Why?
It's paradoxical.
It is. If society universally agrees that children are precious, as the gold ribbon symbolizes, why does the money not follow the sentiment?
Because of the logistical and economic nightmare of pediatric cancer research.
Okay, walk us through that.
Well, the pharmaceutical industry and the broader research ecosystem operate on market economics. The text points out two massive hurdles that make pediatric cancer a terrible economic investment: the rarity and the diversity of the diseases.
Let's break that down, because I think the average person assumes cancer is just cancer. You find a cure for cancer, and it works for everyone. But the source emphasizes the diversity.
Right. Childhood cancer isn't one disease. It is dozens of different, highly specific, biologically distinct diseases.
So a brain tumor isn't treated like leukemia.
Not at all. A pediatric brain tumor, like a DIPG, behaves completely differently than acute lymphoblastic leukemia. They require entirely different chemical approaches.
There is no silver bullet.
There is absolutely no silver bullet. You are not fighting one massive war. You are fighting 100 different micro-wars simultaneously.
100 micro-wars.
And each of those micro-wars requires millions of dollars to fund the basic laboratory science, to move those findings to animal models, and eventually, hopefully, reach clinical human trials.
And that's where the rarity comes in to punish them, right? If you only have a few hundred kids a year getting a specific type of bone cancer, how do you even run a trial?
That is the crux of the issue. To prove a drug is safe and effective, to get FDA approval, you need a clinical trial with a large enough sample size, or N, to provide statistically significant data.
So for adults.
In adult breast cancer or prostate cancer, finding thousands of patients for a trial is relatively easy. But for a rare pediatric tumor, finding enough patients is a logistical nightmare.
I can imagine.
You often have to coordinate across multiple hospitals, sometimes across international borders, which introduces a labyrinth of different data privacy laws and ethical board approvals. It takes immense resources just to organize the trial for a patient population that is incredibly small.
So the market incentives that drive a major pharmaceutical company to spend $1 billion developing a blockbuster drug for millions of adults with high cholesterol or lung cancer, those incentives simply do not exist for a rare pediatric tumor.
They don't.
The economics fundamentally work against the children.
Precisely. It is what the industry refers to as the orphan drug problem, but amplified by the extreme vulnerability of the patient population.
I want to emphasize to the listener exactly why this lack of specialized funding matters so deeply, even for the kids who actually survive the ordeal.
Because survival isn't the end of the story.
Exactly. The source specifically mentions the urgent need to minimize long-term side effects. Because right now, the treatments we use, the chemo, the radiation, they're essentially blunt force instruments.
They're weapons of mass cellular destruction.
Exactly. I've heard people compare to using a sledgehammer when you need a scalpel, but honestly, that feels too clean. It's more like trying to rid a house of a termite infestation by setting off a bomb in the living room.
That's a very vivid way to put it.
Yes, the termites die, but the foundation of the house is permanently cracked, the plumbing is destroyed, and the wiring is fried. We are curing the cancer by pushing the child's body to the absolute physiological brink of what it can survive.
Which leaves lasting scars.
Right. That means even when a child beats the cancer, they might suffer lifelong complications.
The medical term is late effects, and they can be devastating. We are talking about severe heart defects from the cardiotoxic chemotherapy drugs. We are talking about profound cognitive delays from whole brain radiation.
They can't learn or develop normally.
Right. We are even talking about secondary cancers later in life caused by the very radiation that cured their primary tumor.
So you beat the monster when you're 5, but the sword you use to kill it poisons you when you're 30.
That is the tragic reality for many survivors. The goal of modern research isn't just basic survival, it is the quality of that survivorship. But developing those gentle, targeted therapies that only attack the cancer cells without destroying the healthy tissue takes an immense amount of time and money.
And time is the one currency these families simply do not have. Recognizing that research takes years' time that many children unfortunately do not get to experience, the source guides us to a deeply emotional, very tangible aspect of this movement.
This shift in focus.
We have to talk about what happens when the casseroles and the clinical trials aren't enough. Which brings us to the concept of memorialization.
The source outlines how, for grieving families, the gold ribbon undergoes a profound shift in meaning.
How does it change?
It transitions from being a symbol of an active, desperate fight and fierce hope into a symbol of remembrance. It becomes a tool to honor the precious lives that were taken too soon.
The text mentions a very specific resource here, which initially caught me off guard.
Oh, the funeral program site.
Yes. It highlights organizations like the Funeral Program Site, noting their role in providing customizable, ready-to-wear ribbons, and explicitly mentions them as offering the largest provider selection available.
It seems like a specific detail to include.
Right. At first glance, reading about a vendor in the middle of this intense emotional and scientific discussion felt a bit jarring. But when you really think about the psychology of grief, it makes complete sense.
It does make sense. It explores the psychological importance of physical objects in the grieving process.
People need something tangible.
Absolutely. When a parent loses a child, the pain is so abstract, so infinite, and so overwhelming that there is a profound human need to anchor that grief to a tangible token. You need something to hold.
And regarding the specific mention of the Funeral Program Site, it isn't about advertising a product, is it? It is about the logistics of grief.
Exactly. The logistics of grief are brutal.
When a family is in the immediate aftermath of losing a child, they are essentially incapacitated. They are planning a memorial or a celebration of life, which is the most unnatural thing a parent can ever do.
It goes against every instinct.
The last thing they need is logistical friction. A vendor that provides a massive selection of ready-to-wear, customizable ribbons removes that friction. It allows the parent to focus entirely on the meaning of the artifact rather than the stress of sourcing it.
Exactly. It is about practical accessibility during a period of total cognitive and emotional overload. But on a much deeper sociological level, it is about transforming a universal, mass-produced symbol, a standard gold awareness ribbon, into an intimately personal artifact of legacy.
Right, because an empty gold ribbon means awareness, but a gold ribbon with a name on it means something entirely different.
Precisely. By adding a specific name, a specific date of birth, and a date of passing through customization, a parent is actively reclaiming their child's identity from the disease.
It's an act of defiance, almost.
It really is. You are telling the world that this isn't just a statistical loss to a rare biological anomaly. This was a specific human being who had a favorite toy, who had a laugh, and who mattered immensely.
It is deeply heartbreaking that the exact same gold ribbon worn by a survivor to celebrate beating the disease is worn by a grieving mother to memorialize her absolute worst nightmare.
It's the duality of the symbol.
It holds the entire spectrum of the pediatric cancer experience within one color. But it makes me wonder about the broader impact of that personalization. When a parent prints their child's name on that ribbon and wears it to the grocery store or to the city council meeting, does that help bridge the gap between private family grief and public awareness?
It doesn't just bridge the gap, it shatters the psychological defense mechanisms of the general public.
What do you mean by that? How does it shatter them?
Well, as a society, we naturally distance ourselves from tragedy. It's a survival mechanism. If we deeply felt every tragedy in the world, we couldn't function.
True, we'd be paralyzed.
So when we hear childhood cancer, we nod politely, we feel a vague sense of sadness, and we move on. But when you see a grieving parent wearing a ribbon with a distinct, irreplaceable face, or a specific name like Sarah, 2018 to 2023, you can no longer brush it off as a sad medical statistic.
It becomes real.
It forces public confrontation with the reality of the loss.
It demands that you look at the human cost of that underfunded research we were just talking about.
Exactly. And that deeply personal memorialization naturally evolves into the broader public advocacy efforts that push the entire movement forward. Grief, when shared publicly through these personalized tokens, transforms into the most powerful fuel for systemic change.
Which leads us into the final major theme of our deep dive.
Yeah.
Translating that immense grief and that fierce hope into tangible structural action. Advocacy and the future.
This is where everything converges.
The source outlines that advocacy is the actual mechanism that promotes better healthcare policies. It is what forces the hand of lawmakers to increase public research funding, and it improves access to treatment. Awareness campaigns are designed to educate the public to prioritize pediatric cancer in larger healthcare discussions, so it doesn't get lost in the noise of adult diseases.
This is where the text synthesizes everything we have discussed today. The entire ecosystem, the brutal biological realities, the family struggles, the community meal trains, the glaring funding deficits, and the personalized memorial ribbons, all of it funnels directly into advocacy.
It's all connected.
It is. The gold ribbon, at its highest collective level, represents a unified voice demanding that pediatric cancer is not pushed to the margins of medical science just because it is rare and economically inconvenient.
But I have a question about the finish line here.
Okay.
The text asserts that the future relies heavily on advances in technology and medical science to ensure that every single child has access to effective treatment. Given what we discussed earlier about the incredible diversity of these childhood cancers, the 100 microwars, is technology actually capable of providing a way out, or are we just hoping for a miracle?
It is not just hope. The science is genuinely revolutionary, provided it gets the funding. Advanced technology is the only viable path forward to replace that bomb-in-the-living-room approach we talked about.
So what does that look like?
We are looking at things like genomic sequencing.
How does that actually work in a pediatric context?
Instead of just looking at a tumor under a microscope and guessing which blunt force chemical might kill it, scientists can now map the exact, unique genetic mutation causing a specific child's tumor.
They read the tumor's code.
They sequence the DNA of the cancer cell. Once they find the specific line of broken code, they can theoretically develop or utilize a therapy tailored specifically to target that one mutation, leaving the healthy cells completely untouched.
That is incredible. And what about immunotherapy? The source hints at new therapies.
Immunotherapy, specifically things like CAR T-cell therapy, is breathtaking. In simple terms, doctors extract the child's own white blood cells, the T cells, which are supposed to fight disease but are currently ignoring the cancer.
Okay, they take them out.
They take them to a lab, genetically reprogram them to recognize the specific cancer cells as an enemy, multiply them by the millions, and put them back into the child's body.
Oh.
You are turning the child's own immune system into a highly trained microscopic assassin that only hunts the cancer.
That sounds like science fiction.
It does, and it works. But the catch is that these technologies are incredibly complex, highly individualized, and obscenely expensive to develop and administer.
How expensive are we talking?
A single round of CAR T-cell therapy can cost hundreds of thousands of dollars just for the cellular engineering.
Which brings us right back to the central problem. Money and advocacy. The families cannot carry the political and economic lobbying entirely on their own. They are too busy fighting for their lives or too busy grieving.
Precisely. That is why the advocacy for funding is the linchpin of the entire movement. The technology exists in theory, the scientists are eager to do the work, but the financial pipeline has to be built by public demand.
It is a massive, incredibly interconnected puzzle.
It really is.
As we bring this deep dive to a close, let's take a moment to recap the journey we've just taken through this source text.
It's been a journey, definitely.
We started by looking at the stark biological mysteries that fundamentally differentiate childhood cancer from adult cancer. The fact that it is an unpreventable strike of lightning, a developmental glitch that shifts the entire burden onto urgent care rather than preventative lifestyle changes.
And how that affects the family.
Right. We walk through the intense emotional and logistical ecosystem of the family, understanding how a single diagnosis creates a shockwave that requires family-centered care to prevent total collapse and turns healthy siblings into vulnerable glass children.
And we examine the profound response of the community, recognizing that empathy and logistical support are vital survival tools, but that they must eventually give way to the hard science of medical research.
Right. We looked at the critical paradoxical gaps in that research funding, where one of the leading killers of children struggles to get the economic attention it desperately needs because of the rarity and fragmentation of the disease.
The orphan drug problem.
Exactly. And finally, we explored how families process this agonizing journey when time runs out, using tangible acts of remembrance like utilizing resources to create personalized ribbons from places like the funeral program site to reclaim their child's identity.
And translating that grief.
Yes, seeing how that very private grief
Mm.
is ultimately weaponized into loud, public, systemic advocacy for revolutionary technologies like genomic sequencing and CAR T-cell therapy.
It is a profound trajectory from individual, isolated suffering to collective structural action. The source material does an exceptional job of proving that the gold ribbon is so much more than a passive marker of a sad topic.
Exactly. For you listening right now, the ultimate takeaway here is that the gold ribbon is not just a passive piece of awareness for you to politely acknowledge.
It requires action.
It is an active, urgent call for resources, for deep community empathy, and for rapid scientific advancement. It is a symbol that demands engagement from those of us who have the privilege of not currently fighting this battle.
It demands that we don't look away from the harsh reality of the pediatric ward, but instead look directly at it and ask how our collective voices can support the infrastructure that will eventually cure it.
The source tells us that the gold ribbon represents a future where childhood cancer is no longer a devastating reality. But think about this, and I want to leave you with this final thought to mull over long after this discussion ends.
It's an important one.
When you see someone wearing a personalized gold ribbon, you are not just looking at a piece of fabric. You are looking at a profound, highly volatile intersection. It is the intersection of unresolved, infinite grief and fierce, uncompromising hope.
Beautifully said.
You are looking at the shattered framework of childhood we talked about at the very beginning, the scraped knee that couldn't be fixed with a bandage, the innocent system failure that no one could prevent. How do we, as a society, ensure that the memories of the children we couldn't save become the exact potent fuel needed to save the children of tomorrow?
That's the question we all need to ask ourselves.
Thank you for joining us on this deep dive into the sources on the Funeral Channel Network podcast. Keep asking the hard questions, keep looking beyond the surface of the symbols you see every day, and always seek out the why behind the world around you.